All right, so welcome to Top Floor Women. How many of you are first timers? Yay! Welcome. We love having you. This is awesome. We meet the first Wednesday of every single month, 8 to 9:30. So bring your business cards, bring a friend. This is a growing community, and we love serving you. Part of this, we started in 2017 in Franklin, and then it has evolved. And Katie, for the last year, this is our 1-year anniversary from being here. Thank you. So Katie's a visionary, and she said, hey, we're growing. Like, come to stage one. We have plenty of room. So we do lots of different events, so stay tuned. One note that Facebook is kind of changing groups. And so for the last few months, I've tried to put the Top Floor Women group that has been on Facebook more in my Wix website, because that's kind of where you register for the event. So if you're not in that private group, there's a link on the registration page, and it'll just say join the private group. That'll just give you more access, more information on kind of what we're doing activity-wise on a monthly basis, right? You can go to the registration page and you can see who's speaking. But for more things, if you guys are posting or if we have sponsors for things, I really want you to be involved in that so that you don't miss out. Because a lot of times on Facebook, it's like you don't see it or you do see it or it doesn't post for some reason. And I think they're changing groups a lot in Facebook. So anyway, I'm trying to protect our group as well. So a couple of things, just wanted to also welcome all of our new members. And Katie Stallhut is our sponsor for our events for stage one here. You're awesome. My company is Everyday Leaders, so I do leadership development and coaching and training and fun games, activities. So if you're looking for an event to plan, keep me in mind. Also want to thank Joe X Studios for our always recording our speakers for production. On the Facebook page and also on the registration page, you'll see a YouTube link. If you click that, you can subscribe, but you don't have to. It's better if you do. But if you go there, you can see all of our speakers from the last almost 3 years now that he's been recording these. So we have a lot of awesome people that have presented some phenomenal topics and growth. So I encourage you to pass it around and share it, and then also get engaged with it, because it's been really great and we appreciate it. 2 things we have this morning before we get started with our wonderful speaker, Dr. Robyn Wright. Amanda Sparks is our coffee sponsor today. So what that means is you can be a coffee sponsor and bring a bag of coffee, a 1-pound bag of coffee, and we use it next month. And she brought some snacks this morning, but we give her an opportunity to talk about a passion that is on her heart or her business. So, Amanda?
Thank you. Good morning. How is everyone today? You guys are... I did not believe you. How is everyone this morning? Oh, that's so much better. So much better. Thank you, Mel. Can we give Mel a round of applause? Without her vision for Top Floor Women, or stepping in to take over that vision, we wouldn't be here, and we wouldn't be able to meet the wonderful women that we do month after month. So thank you, Mel. I am here to talk about Allies today. Allies is an anti-trafficking organization. We serve young ladies between the ages of 12 and 24 in Indianapolis and the surrounding donut counties. And we need mentors. What does that mean? Who here has a couple of hours, a couple of times a month that they could use? How many of you scroll Facebook? Mindlessly, hours upon hours upon hours. How many of you just kind of waste time watching TV? Hour after hour. So there are opportunities within your schedule, if you think about it, that you could step in and be a mentor if you so choose. If anti-trafficking is not something that you're interested in, how many here are interested in homelessness, foster care, addictions, domestic violence, sexual assault? all of the girls that we work with experience 9 of the big T traumas, 9 of the 10 big T traumas. They have not experienced what love or a healthy friendship looks like. And so we need people to pour into them and to love on them. So if you do have a heart for one of those other things other than anti-trafficking, I encourage you just to take a look. Our mission is to empower survivors of trafficking through mentorship and through a supportive community. This past weekend was the epitome of who we are at Allies. We have some really, really hard days, and we have some really, really tough problems that we help our girls work through. But this last weekend was just celebration after celebration. So I want to share some of those. So this young lady, we call her C. We use initials because we don't want to give their identity. But C has been mentored by Kristen, who is in the white. Kristen decided to do 2 friendship packs with her. So that means they made a commitment to be friends for 12 to 18 months. We first had 12 months, and then we went to 18 months. So Kristen did 18 months and 12 months with C. They are good friends, and we just celebrated that. And C got her GED. Next, we have E. And if you want to hear more about E, she has a whole podcast on our Everyday Advocate podcast. But this is a supportive community for E. E graduated cum laude on Friday. She also got a certification in social work. But these are all of the people from the Allies community who came to support her at her graduation. So we've got Beth. Beth is in the back. She's our program administrator. We have her former coach, which if you become a mentor, you will get a coach to walk alongside you. We have myself. We have a volunteer who just gives her rides periodically, and we have her mentor and her mentor's baby. This is how she graduated or how she decorated her graduation cap. If you knew my story, you would be proud. I am beyond proud of this girl. I have seen her walk through some really, really difficult things. I've walked beside her through some really difficult things. She is coming out on the other side. This is an event we had over the weekend. We had over 20 people from the community, 20 organizations that came in to provide resources for the young ladies. So these are some of the people that were at that event. It was like an open house style, so we didn't get a picture with everybody, but it just kind of gives you an idea of what that was. And then we got to have a baby shower with one of our longtime mentees. She has been in our program since she was 15. She's 22 now. She's having a baby, and she's killing it. She's just doing great things. So if you want to help a young lady go from really, really dark places and help them see the light, then please look on the table. It says Mentors Wanted. There's a QR code, and you can click on that for the application. And that is it. Thank you.
Awesome. Thank you, Amanda. It's an amazing organization. Yes, are we good? Okay. One other thing that's on your table, just want to bring this to your attention. So how many of you know Johnson County Senior Services in our community? Yeah, they serve 8,700 seniors a month. And so we decided we're going to help them do a promotion because they lost a big donor this year. And they're in a lot of need. You may see them on Facebook, and they're posting that they need their pantry filled. But I have a friend that's coming in town. If you guys attended the Live to Lead event, Chip Baker is going to be here next week for another event. And we're going to we decided on Thursday next week, July 10th, that we're going to do an interview live broadcast to help Kim raise some money. So we created this Shine for Circle Senior Club, and it includes a t-shirt if you donate up to $120, a one-time donation, or you can donate $10 a month or whatever gift that you'd like. There's a QR code on the tables here with just the information on it. So we're going to do a live broadcast kind of promotion for her nonprofit from 6 to 7 next week on Thursday. So if you're interested, you can follow it. I'll post it on the Top Floor Women page as well, just to give you some updates. But if you donate anything, you'll be included, and you can watch the live broadcast. The first 5 that register as a $120 sponsor will get to be in the studio as a live participant. So you'll also get to kind of talk about why you're passionate about Johnson County Senior Services. So that's it. I'm going to turn this over to our wonderful speaker this morning, Dr. Robyn Wright. So hormones, health, joint health, everything that you should know at this stage in your life, every one of us, she's going to help educate us. So Dr. Robyn Wright, take it away.
Okay, will do. Yep. Got my clicker. Everybody can hear me okay? Good? Okay, make sure my volume's okay. So I am Dr. Robyn Wright. I'm a licensed naturopathic medical doctor, and I'll kind of talk about what that is, but my clinic is Healthy Evolutions. I have one here in Greenwood in the old Jonathan Bird building, and then one in Scottsdale as well, if you're familiar with the area. It's like 95th and Shea, right by the hospital there. So I actually split time back and forth, but that's the clinic, and we'll kind of go through what my training is. So for me, I went to LaSalle University and played Division I volleyball, and that's in Philadelphia. And then from there, I graduated, and I went into actually PA school up in Fort Wayne, and I didn't know about naturopathic medicine at that point in my life. And I just kind of felt like something was missing. I was like, this is kind of weird that I'm just doing my rotations, spending 5 minutes with a patient and either not touching them for a physical exam or just giving meds or increasing meds. It wasn't really any kind of real conversations that were happening, and I didn't feel like something was missing, I guess was the point. So I ended up withdrawing from there. And I went into pharmaceutical sales, which was the other end of the spectrum, which was a very interesting layer to the onion as well. So that was eye-opening, and I really didn't know much about that, so I kind of saw how that side of the healthcare worked. And then I ended up managing weight loss centers. So I managed weight loss centers, and that's actually where I first learned about naturopathic medicine. One of the girls that I had managed, she graduated from Bastyr University, and not with her naturopathic degree, but she's like, you need to look into naturopathic medicine. And so I did, and I was like, oh, this sounds pretty interesting, and ended up kind of kicking the can down the road. I was a health coach. I actually got my 200-hour yoga teacher training. I have 2 kids. And my health coaching business is kind of where I decided, I was like, you know what, like I need to go to medical school. So I went back to medical school at 32, had my daughter in medical school and had my son in residency. So it was a very blur. If I look back, I'm like, I don't know how I did it, I just did. I would not recommend it, but here I am, I survived. But yeah, so I'm a mom of 2, and I've had about 20 years in healthcare in a variety of capacities. Even in my summer breaks from college, I would work at Select Physical Therapy here, just like helping out with the exercises, and then, various things along the way. I worked front office, I managed the back office, I did the medicinary piece, working as a health coach that was contracted with companies, and then all the way up to physician at this point. So I have a deep understanding and appreciation for all levels of healthcare and truly what it takes to make a practice run and tick and all of that. So everybody's important, and I will tell you, your front desk is the most important person, hands down. So if you got a good one, keep them. Okay, I did 1 year of primary care residency after graduation, and then after that, I ended up staying around helping the new residents for another year, and then I worked at another clinic for a little while before I started Healthy Evolution. So I've been practicing now for about 6.5 years or so. Most people, I guess the formatting got weird. Anyway, most people don't realize the depth of training that a licensed naturopathic doctor has, so I wanted to kind of explain some of that. So we attend a 4-year medical school, including 100 hours of pharmacology, and the medical school is accredited by the Department of Education. So this is not a certificate program that you see as a scroll or an ad or whatever. It's a legit accredited naturopathic medical school. And there's really only 5 of them in North America at this point. So that's an important thing to understand. And we do have that 100 hours of pharmacology, which is really nice because we also have 2 years of botanical medicine. So I'm taught all the herbs as well. So we know how the herbs interact, the pharmacokinetics, with the pharmaceuticals. So I got a lot of patients that come to me already on medications, and maybe they, want to get off or reduce the dosing or whatever that is. I have that skill set to take the prescription over and then manage that process of moving them to the herbals only or reducing the dose herbals and then using herbals, or ultimately the goal is to get off everything, right? So that's a really big thing. People don't realize that. I also have training with acupuncture, really all TCM, traditional Chinese medicine. So acupuncture, cupping, not an in-depth herbs, more so for Western herbs and more so the Eastern herb, but that as well. Chiropractic care I'm trained in as well. It's not to the level of a doctorate of chiropractic care, but I have the skill set if somebody comes in and, you know, first ribs out or they need a neck adjustment, I'm capable of doing that and doing a physical assessment. So we're truly trained in like all aspects of physical medicine as well. And then IV therapy is a big one. I do a lot of IV therapy in my clinic in Scottsdale and Ozone. And we can customize those. Those aren't just the cookie cutter Meyer cocktails that you might find. They're very nuanced, and we go based off of labs and symptoms and what's going on with the patient to create a specific protocol for them in that way. Nutrition, of course, we got 2 years nutrition. Homeopathy, if you guys are familiar with homeopathic medicines, like the little white pellets that dissolve under the tongue. Very well versed in that. Trained more classically in that way. There's different ways, but more classical homeopathy. It can prescribe medications in most licensed states. So there's currently, I think we're up to 26 licensed states for naturopathic medicine. And hopefully Indiana is going to be in 2026 because I'm really pushing hard legislation-wise and meeting with all the people up in downtown there to get us licensure here in the state of Indiana as well, because unfortunately they do not recognize our training here. But I do have a DEA number and an NPI number, which means that I can prescribe controlled substances. I also can prescribe medication. So that's nice. Again, when I'm taking over those prescriptions, I don't have to keep kicking them back to their prescribing physician for dose changes. We could just take that over and manage that. Of course, I do refer. I refer to cardiology, I refer to gastro, I refer all the time because I prefer to work collaboratively because my skill set, I don't have the ability to do some of like the imaging that they may do in office or like a transvaginal ultrasound. That's not part of my scope. So I do work very collaboratively with specialists in that way too. We take 2 sets of boards, NPLEX 1 after year 2, NPLEX 2 after graduation, and then that allows us to get our licensure. We do have to maintain our CMEs every year, and we can't contract with insurance, but patients are more than welcome to use their HSA accounts, or I can provide a super bill to the patient and they can submit to the insurance on their own to see if they can get any kind of reimbursement back. So that's a little about the training that we have, and really our curriculum till about year 2 mimics what an MD or a DO would have, and then year 2 is where we kind of go more into the naturopathic skill set that we're seeing here and more of that kind of detailed training. And also like our approach to the patient is a bit different as well. So we're not really trained in the algorithmic approach where it's like, you come in with this symptom, okay, then we go here. And if that's present, we go here. If it's not present, we go there. It's not really like that. We're really looking at the whole person from inside out and trying to figure out the real root cause of things, right? So it's a bit of a different approach to patient care as well. Anybody have questions on that so far? It was kind of a lot, but I just think it's important to let people know that is actually our training. What we are not health coaches. We are not graduates of a naturopathic certificate program like Trinity College, but we are trained in standard of care. We first and foremost trained in standard of care. So for instance, if somebody comes in and they have symptoms of a UTI, I'm going to test them for a UTI and I'm going to find out if it's a UTI. And if it is, like sure, we may give it a go and figure out what herbs we could use that may take care of it. But if we're 3-4 days in and you're no better, you're worse, yes, I would prescribe an antibiotic because that's an emergent condition and that's not safe. So we always are looking at the standard of care as well. We don't want to risk anything. It's not worth that, right? So yeah, trained as primary care in standard of care. And for me, like I said, I can prescribe medications in most licensed states, can obtain DEA number in most licensed states. And really Arizona, we've had our licensure there for 90 years. So our scope is huge compared to some other states too. But yeah, working on that here. Okay, so today I wanted to kind of go over body composition and hormones, aging, and weight management. As we age, obviously we know that there are cellular changes that are happening. They're just not turning over as easily or as quickly, and things can kind of go awry a little bit faster. And what we used to work in our 20s probably isn't working in our 30s, 40s, 50s, 60s, right? Like everything's a little different. So it's important to understand how all of these, and especially with the hormones, are going to impact all of that. So body composition. So this is going to refer to the proportion of fat and fat mass in the body. So fat mass is all fat mass. The non-fat mass would be like your muscles, your bones, water, and other non-fat tissues. So when you're thinking of what that actual definition is, that's what we're talking about. And then measurement methods. So BMI is your body mass index. Most people have probably heard about that. With the BMI, it's really just a ratio, and it doesn't give you the full picture. So it's not telling you, okay, yeah, maybe your BMI is in range, but maybe your body fat percent is super high. Well, body fat percent, if it's high, that puts a lot of risk factors on board. So it doesn't really give you the full picture. And also, you think about individuals like on both ends of the spectrum. Like think about like an athlete, right? Like a professional type athlete or a college athlete. You know, they may show up as obese because they're tall and they're big, right? They got a lot of muscle. They may show up as obese on a BMI, but their body fat percent is nothing, right? And the other end of it is the individual who's very appearance-wise very thin, and BMI would be on the lower end, but then their body fat, if you ran that, could be very high. So just because you're fitting in that BMI range doesn't really give you the full picture of what the body composition is. So that's the body fat percentage, and that also is important because, of course, that's risk factors that we want to know. Mainly the hydrostatic weighing, skin fold measurements, the bioelectrical impedance thing, like like in-body. Have you guys ever heard of in-body scans? You stand and you hold the arm things, and it sends an electrical impulse, so it does a measurement that way. Tanita is another one that does that. Those are the most common probably ones, and then the dual energy X-ray, which is your DEXA scan. That actually is very, very good at a true body composition analysis. Most people know the DEXA as for bone density, which is true. That is definitely what that's used for as well. But you can also use it to assess your body composition. So the DEXA scan is considered the gold standard for body composition analysis. And then with that hydrostatic weighing, what that is, if you've ever heard like the bod pod before, where you're basically in water. So that's kind of what that's referring to. And then they don't really use them now, but some offices, the skin fold measurement, so there's little calipers that they would do, they would put on the back of the arm and whatnot to test to see. So those are the ways to do it, but your DEXA is actually going to be the gold standard for your body composition analysis. So hormones. So cortisol, is anybody familiar with what cortisol is? Yes, go. You want to try?
Stress hormone.
Yeah, it's a stress hormone. So. Sure. So cortisol, if you think about your parasympathetic and your sympathetic nervous system, your parasympathetic is very calming. Your sympathetic is like, the bear is chasing me, I need to run, right? So a lot of times, especially in modern times, we wake up like we hit the floor and we're stressed, right? There's 465 traffic, or I have to run my kid here, or I forgot this, right? Or work stress, life stress, right? Our body does not know the difference if the bear is chasing us versus those types of stressors. So if you think about it, in a modern society that we live in, most people are under chronic stress of some sort. And that's a problem because if we're pushing that sympathetic nervous system all the time, we end up getting stuck in that sympathetic overdrive, which is a problem. So, and you're referring to adrenal fatigue. So that technically is called HPA axis dysfunction, and really that has to do with the feedback loop. So your hypothalamus, your pituitary, your adrenal, so HPA, and then the axis is really referring to that whole communication system between the brain and the adrenals. And the adrenal glands sit on top of your kidneys. I call them little kidney hats. So if you're visualizing it, it's like right there on top of the kidneys. So the problem with having high cortisol is you can have a lot, and they kind of mimic in some capacity, they overlap. So high cortisol, many people will have trouble sleeping, they'll gain weight, their blood pressure and heart rate can be higher, lowered immune system, trouble with your blood sugar. You kind of are more on that edge. Like sometimes, people, you may know a friend, or maybe you're like this, you walk into the kitchen, you're like, hey, how are you? And they like jump through the roof, like, oh, you scared me kind of thing. They're just always on that edge of like, oh, a little easier to go that way. And that also can really impact your cycles too. So if you're under that chronic stress, you may notice that within your own self, and I see this clinically where people who are really stressed have a lot of hormonal and cycle abnormalities. They'd be like, you know what, I haven't cycled for a couple months, you know. But if you think about it on a evolutionary or a reproductive sense, like if our stress level's high, for whatever reason, you know, if the bear is chasing us all the time, our body's not thinking about reproducing. It's also not going to be thinking about pooping and peeing, right? So a lot of times I see people that present with digestive concerns or reproductive issues or just cycle disturbance, right? Because they're stuck in this fight or flight response all the time. So again, you're looking at, okay, high cortisol can do all of that. And eventually, if we talk about that HPA axis, that feedback loop, it's kind of like the brain's like, you know, all right, we're getting all this signal. We are stressed to the max. We've got other things to do, and it starts to dampen that feedback loop. And so you end up seeing your cortisol levels start to drop. And the problem with that is kind of the same thing. You can have a lot more fatigue. So a lot of these individuals present where in the mornings in particular, they just can't turn the lights on in their brain. They're like, oh, I have to roll out of bed. It just takes forever. Because really, cortisol is what's responsible for waking you up in the morning. So if we don't have enough cortisol in the morning to like really wake us all the way up, usually we're kind of in that zombie land. A lot of patients there present very wired and tired, where they actually do want to sleep at night, but they just can't because they're wired and tired. Like they feel physically tired, but they can't get the brain to kind of quiet down. And they usually are the people that have to hit the coffee as soon as they wake up. They're like, I gotta have caffeine. But it's a slippery slope because typically when you have that cortisol dysregulation and you have the caffeine, it's really challenging because you have a sweet spot where you're good and then anxiety, you know. It's kind of like that. It's like I feel like I need the caffeine because I really can't function. But the caffeine is like that slippery slope of like, yeah, okay, maybe I have a little bit, but then I move into that anxiety realm. So the lowered stress response as well. So things that you used to be able to handle, you're just not able to handle that stress anymore. Anxiety is a big one. Insomnia, low libido is a really big one too. Low blood pressure. Salt cravings is very common in individuals with low cortisol. Brain fog as well, increase with PMS and irregular cycles. And it kind of goes back to what we talked about too. Like if we don't have enough of that cortisol, I always think of the endocrine system as like a little triangle where you have your adrenals, you have your thyroid, and then you have your hormones, right, your sex hormones. So those all kind of go together. And if we have one that's like hanging on, the other two will probably try to compensate, but eventually they'll start to fall down like the dominoes. They can't keep up with all of that. So cortisol is a really big one, and typically a lot of times when the cortisol levels are dysregulated, if you're thinking about distribution of fat, it's like that belly area a lot of times, that cortisol belly, you probably have heard that word before, it tends to accumulate there. And then insulin. Anybody know about insulin? Anybody familiar with diabetes? Ah, you're good, you got this. What do you do? What do you do?
I'm a martial arts instructor, but I'm literally living in this room right now.
Perfect. Love it. Love it. You're educated. I'm like, yeah, this is great. I love to educate. I was talking to somebody out there. I was like, I love to educate because I feel like it's important to empower people to have the education to advocate for themselves. So I always like to go out and educate and share knowledge and make it hopefully not too doctor talky. It was like digestible info. But yeah, so insulin. That one's made from your pancreas, and that stimulates your liver muscles to take up the sugar from the blood. So basically, you eat something, even drink whatever, you will have an increase in your glucose, and then that will send the information to your pancreas, and the pancreas is like, cool, sends out the insulin. The insulin, the whole point really is to bind to the cell. It's like a lock and key. Opens up that cell so that the glucose can get out of your bloodstream so you can burn that as fuel. Problem is if we're constantly pushing that button, eventually the cells become desensitized to the insulin, and then it can no longer really bind to those cells. And that's a problem because we hear the term insulin resistance, right? So once we hit the insulin resistance piece and it really doesn't bind that well, then you're gonna see an increase in insulin in the bloodstream, and you're also gonna see an increase in your glucose in the bloodstream because it really can't get out. And then from there, if you've ever heard of an A1C, like hemoglobin A1C level, that's just a measure of pretty much how sugared up your red blood cells are over 3 months. So then you're going to start to see that A1C level creep up because that glucose has been high in the bloodstream for a while. So that's where you start to think about prediabetes, diabetes, all of that. So for my patients, I'm always looking at a fasting insulin to make sure if we do have insulin resistance, we're catching that way before we're moving into the diabetes talk, right? So that way we can address it. So if we have high insulin, that's the insulin resistance we just talked about, weight gain, again, because if we don't get rid of that glucose, your body's going to want to store that excess glucose as fat. Because fat is king in survival. So that's where we want to look at there. So weight gain, fatigue, that can be a big one both ways. If you think about blood sugar, both ways. If it's too high, you're pretty sleepy, but if you get that low blood sugar, you get sleepy, you get a little hangry, that kind of thing. And then hormonal imbalance, absolutely, sleep disturbances, and AI, autoimmune. So for the sleep disturbance, that goes both ways, and autoimmune also goes both ways. So the sleep disturbance, it's kind of like, and I always ask this question too for my patients who aren't sleeping well if they wake up in the middle of the night. Okay, like when did you eat dinner last? When do you have breakfast? Because if you're fasting for a period of time and you're not having enough protein in the diet, it's normal that your blood sugars are going to have a little dip when you're sleeping. Problem is if it dips too much, then it's actually a stress on the body and it'll actually wake you up because the body's like, hey, we need to have something to help us, function. We can't just not. So it'll wake you back up. So I always ask that question too, like, all right, if I have somebody who's not sleeping well, it's maybe hormonal, maybe stress, could be that. But maybe they're just not having enough food or maybe not enough protein, and we can kind of fix that. Autoimmune, so autoimmune conditions are quite broad and you can go the gamut. You can have autoimmune conditions in your hair follicles, all the way to the pancreas for the islets there. You can have thyroid. It's everywhere in the body. You can really develop an autoimmune condition. So that's something too. If I see somebody that's not really making sense, like why is your blood sugar and your insulin so dysregulated and we're doing all the things, I may explore more of an autoimmune component to see if there's something playing in the background there. And that can go either way, if it's too high or too low. So estrogen, there's two main forms that I really look at. There are other forms as well, but estradiol and estrone, those are the two main ones. So estradiol is what your body actually prefers to use. Your body wants to use the estradiol. And with that, that's made in the developing follicle. It stimulates your mood, libido, serotonin, dopamine. It also benefits bones, muscles, brain, heart, sleep, skin. Uterine lining, stimulates fertile mucus, everything basically in the body. So when we have estrogen way too high or way too low, and we think about menopause in that sense, right? That's a problem. So estrone, that is another type of estrogen that is more inflammatory and proliferative. So a lot of times when I have patients coming in and they have, a really heavy, clotty, crampy, yucky cycles, it's not necessarily that they have way too much estrogen. It's just maybe they have a lot more estrone than estradiol, and or maybe they don't have enough progesterone to balance out the estrogen, because that kind of does the opposite. It helps to balance and keep the estrogen in check. So you're looking at it in a different way. But yeah, that's estrone, fat tissue, and then there's something called the estrobolome within your gut, and that actually will produce estrogen metabolites from gut bacteria from the estrobolome. And that is more inflammatory proliferative, like we said. So symptoms of a higher estrogen, the heavy painful periods, more breast pain. So a lot of women may experience like that breast tenderness at certain times of the cycle, irritable mood, and then increased histamine. So estrogen plays into the histamine pathway as well. So some women have a lot of histamine issues, and they may worsen at certain periods of the cycle when the estrogen levels are higher. So that's always something as well. If somebody has a weird thing, like, I don't understand what's going on. Like my skin just gets really itchy, or I get this really deep itch in my ear. Like something's not right. I don't know what that is. It could be related to the estrogen. Symptoms of low. So we think about, again, more in that menopausal, perimenopausal kind of land there. Hot flashes, night sweats, mood, sleep disturbance, vaginal dryness, body aches and pains, abdominal weight gain. That's the big one. A lot of times in menopause, women are like, I just can't lose this 10, 15 pounds like here. It just won't go. It won't go away. That's a big one. The other thing too with low estrogen, and not to go too depth because I have a whole other presentation on that, but estrogen plays a really big role in brain health, cardiovascular health, and bone health. So that's a really big thing. So for me, when I'm looking at a patient, it's not just like, oh, you're having vaginal dryness and hot flashes. Like, okay, yeah, we can work on that to fix it. But if you think about like long term, we need to figure out a way to live without that hormone for an extra however many years, right? If we're going through menopause around 50, 51, okay, great. We don't have those hormones for how many years? 30, maybe? Okay, our body uses that estrogen, testosterone, progesterone for many, many body processes. So you think about bone fracture risk, you think about dementia, you think about Alzheimer's, you think about cardiovascular disease, heart attack, stroke. And for women, our risk goes up by about almost, I think it's like 50, 60% for cardiovascular disease in menopause. So we catch up to men very, very quickly in the cardiovascular realm. So the role that estrogen kind of plays is it does keep everything kind of squishy and pliable. So if you think about your joints, your tendons, your ligaments, and then your blood vessels as well. So as that goes away, and also with your lipid metabolism, it plays a factor. So as that estrogen goes away, the vessels become more stiff. So I see this all the time where women are like, I haven't changed anything. My workouts, my eating, and my lipid panel is a hot mess, and my blood pressure is up. And it really could be just your estrogen needs to be helped, right? So there are things to look at in that way. And that's very common to see in moving in that perimenopausal, menopausal land, lipid changes and then cardiovascular increase with those things. Bone density as well. And then Dr. Mosconi, she just did a great research on estrogen receptors in the brain. And so you would think because in menopause, those estrogen receptors would down-regulate since you're not making it anymore, but they actually upregulate. So when they give the person the estrogen, you can visualize it now. Like she has it visualized on MRI of lighting up those receptors. They actually upregulate. So they're super important for your brain health too, for estrogen. All right, and then the big one, testosterone. This is an androgen that induces male-like characteristics. So you think about, hair and, on the chin, maybe you get some back hair, that kind of stuff. And then that's largely produced in the ovaries and the adrenal glands. Symptoms of a high testosterone, that jawline and then the back knee, facial hair and hair loss. It's actually a lot of people don't think about hair loss and testosterone, but there's different forms of testosterone, the same as there are estrogen, and one of them is DHT. And so for some women and even men, they tend to have a higher level of the DHT, which tends to put that more into a male pattern hair loss. And then symptoms of low motivation is a really big one for this that's overlooked, I think. It's different than fatigue. You may have the energy to go do something, but that low motivation, you don't have the oomph to go do it. You know what I mean? Like you're like, oh yeah, I feel good. And you're like, oh, but I can't go do it. It's the mojo. So that motivation tends to be low. And then loss of muscle mass. So we do need to have, testosterone on board to maintain and build muscle. If we can't maintain the muscle either, so say, you know what, like I'm working out, I'm lifting, I'm doing all the things, I'm not gaining anything, but I'm actually feel like I'm losing it, you might have low testosterone. You might want to look at that. And then we always think about libido and testosterone. It's not that simple of just low T, here's some testosterone and libido's back. Way more complicated than that, but in general, yes, if you do have low testosterone, that is, a large majority of women and men will have a lowered libido. Thyroid hormones. So this is kind of a broad one as well, but in just very simplistic terms, your TSH, your T4, and your T3. The TSH, that's your thyroid stimulating hormone. So that one comes from your pituitary gland and it goes out into the body. The body's like, all right, cool. We need to make more or less thyroid hormone. So T4 is made. T4 is really not usable in the body. So it is then converted to T3. So T3 is your usable active form of your thyroid hormone. That's important because that'll feed back to tell your brain to make more or less TSH. So when you're looking at lab work, the higher your TSH, the more hypo, more slow functioning your thyroid would be. The lower your TSH, that's more of a hyper, or the faster that your thyroid would be performing. So all that to say, when you're looking, for me, when I look at blood work, I run a TSH, a free T4, and a free T3. And I like to run the free versions because if I just run a total T4 and a total T3, it doesn't differentiate between what is circulating in the blood and what is bound to the protein. So if you look at just a total, you're not differentiating that out. So you may look normal, but if all of that is bound and it's not circulating, then you're not going to really get a true picture of what to treat. So I always look at those, and I always run the antibodies as well. So TPO and TGA antibodies. If you guys have ever heard of Hashimoto's or Graves' disease, those are very, very common thyroid autoimmune conditions, which I do treat, and I have Hashimoto's myself. So all that to say, I catch Hashimoto's a lot in people. They'll come in and they have all the signs and symptoms of hypothyroid, but they're being dismissed by their provider for whatever reason, or they're on a medication and they just keep increasing the dose, and they're never really looking to see what's going on. So I find Hashimoto's and Graves' disease quite often in my patients. Okay. So changes in body comp with aging. Muscle mass and sarcopenia. Does anybody know what sarcopenia is? Yes.
Muscle degradation.
Yes, it is age-related muscle wasting. Yep. That's the medical, but yeah, your muscle starts to pretty much degrade. And this actually, bone and muscle, about age 35 is when we really see it start to decline. So this is the normal part of aging. And as the muscle mass will go down, you will see more body fat, right? Because you don't have anything there. So your body composition changes. So this is why we talk about the importance, especially, and you see this probably now more, it's more of a thing like the weighted vest, right? Like walking with your weighted vest and doing weights and not being afraid to lift heavy weights too. It doesn't mean we're getting bulky, but it's an important thing that we're maintaining and building that muscle mass. We lose about 3 to 8% of muscle mass per decade after 30 years old. So if you think about what that translates to by 50, 60, like that's significant amount. So with that, you also have the body fat percent, but it's something called inflammaging, which is inflammation increase with aging, and that's largely due to this muscle loss that you see here. So with the sarcopenia, yeah, lifting would be helpful, and then gaining testosterone levels, right, because we want to make sure that muscle mass we can maintain. Those are big ones. And then protein, right, we have to have protein in order to maintain and build muscle. So that's another thing we'll kind of talk about too for dietary things we can do. So increasing the fat mass, I kind of talked about that. Again, losing that muscle. There's that. Also the hormones. Hormones are important for fat metabolism. Those go away. We don't have that ability to maintain and also metabolize like we used to. And then also visceral fat. So that's the fat that's around the organs. We don't want that. We don't want an increase in that. And again, that's part of aging. We tend to see more visceral fat accumulation, and that's more linked to your metabolic disorders. So you think like metabolic syndrome, blood sugar dysregulation, higher cholesterol, like all of that kind of stuff. So that's an important thing for fat mass to realize is as with aging and body comp, we do see visceral fat increase. Bone density and osteoporosis. So what does that mean? So osteoporosis, actually the definition is a T-score of negative 2.5 or lower. So the more negative, the worse the osteoporosis. If we're above that negative 2.5, that actually is osteopenia. So you go, we're good, bone health, and then we go osteopenia, and then we move into osteoporosis. So again, that's an important thing. Clearly, we don't want increased risk factors, so we don't want balance issues. We don't want any of that. Decreasing your bone density with age, postmenopausal women in particular, with that increased fracture risk. And then women can lose up to 20% of bone density in the 5 to 7 years after menopause. So menopause is that full definition of no period for 1 year, right? So within that first 5 to 7 years, you can lose up to 20% of your bone density if you don't do anything to help support that. So really important to get on it as soon as possible, because we saw even here, the bone at age 30, 35, we start to lose that as well as the muscle. So the earlier you can get started, great. If you're already 60, 70, it doesn't matter, just start someplace, because you can definitely make some measurable changes in that way too. The importance of the body composition and weight management. Increasing your metabolic rate. So muscle mass, they're actually studying it now, and it's behaving more like an organ. So it's really cool what they're coming up with. And when you think about it, it kind of makes sense, because they have GLUT4 receptors, like it's like an organ, it's like a metabolic organ. So muscle mass, the more muscle tissue you have, it's more metabolically active. So things like things that are going to increase your basal metabolic rate. So if you've ever heard of boot camps, right? So Fit Body Boot Camp, or even CrossFit, or any of those circuit kind of trainings, that also really helps, because you're going to build muscle, but you're also going to have the EPOC, which is going to help you to burn fat a longer period of time, even after that exercise or the workout is over. That's a good one. BMR is really just the number of calories your body burns at rest. And there's ways, again, if you're resting, that you're still increasing that BMR, and you can do that through different workout methods, a couple of I mentioned there. Calorie burn, right? So higher muscle mass leads to increased calorie burning, making it easier to maintain weight without exercise calorie restriction. This is a big one that I see, and I have to it's a mindset thing where people think, oh, if I eat less, I lose more. That doesn't work like that. It does not work like that. And in particular for women, as we're aging, moving into that perimenopause, menopausal realm, no, you do not want to be doing that. You want to make sure that you're nourishing your body and you're doing the correct type exercises to build and maintain the health that we're at. Running ourselves into the ground isn't going to work very well for us as we age. We need to put other like weight training on board with that. Cardio is fine, but you can't just rely on that. Our body just doesn't respond the same way. It needs something different at this phase of life. That calorie restriction, sure, you need to cut some out if we're trying to lose weight, but a lot of times I see it's excessive, where a lot of times I do an intake with my diet with people, and I'm like, you're not eating enough calories. You're eating like 1,200 calories for the whole day, and you're trying to take care of kids and run a business and, work out and everything else. That's not going to cut it. Absolutely not. And again, your body will look at that as almost like a starvation, and it'll hold on to stuff and you store it as fat. So it's important that you're actually having enough calories, and then working to figure out what you want to make those calories up of is very individualized. We talk about macros and stuff like that. Increased metabolic rate. Yep. And then improve insulin sensitivity. So we already talked about that. But muscle, turns out, is like a great big glucose sponge. So even doing a walk after dinner, moving the muscles, will help to grab the excess glucose and uprate the GLUT4 receptors and then process that through. So it's huge in the insulin sensitivity. You do see this with age too. You'll see people become more insulin resistant and then move into more diabetes, because the muscle is going away due to sarcopenia, and they're not doing anything to mitigate that. So reducing that fat storage, you're going to have better insulin sensitivity, and reducing your accumulated fat, especially in this abdominal area. So hormonal balance, people might have heard of leptin and ghrelin, especially with all the GLP-1 stuff like tirzepatide and Ozempic and all of that. So leptin and ghrelin. Leptin is the signal, the hormone that tells your body we are full, and ghrelin is like grr, like your belly's growling because you're hungry. So those are really important, but the proper body composition, that will help to balance those hormones out a lot more. So with the leptin, ghrelin, you're thinking of those hunger signals and turning them off and on. But with the right body comp, it will actually help reduce overeating. And then hormone production. So adequate muscle mass also does support the production of your hormones, especially testosterone and growth hormone, which is crucial for your maintenance and fat metabolism. HIIT. So this is one, there are a variety of ways you can do it, but it's a type of exercise. It's an excellent tool for body comp. So we talked a little bit about this earlier, the calorie burning and fat loss. So you do short bursts of intense exercise with brief periods of rest, and that will maximize your calorie burning during, and it will then allow you to continue to burn calories after. And that's really it's called EPOC. It's a post-workout phenomenon. And that's how that HIIT type workout is really beneficial. It also results in reducing your body fat, thus improving overall body composition. And then muscle preservation. So unlike your steady state cardio, that can actually lead to muscle loss if it's not paired with strength training. HIIT does both. So you get the resistance training plus you're doing the cardio, and you're also going to help to preserve that muscle mass while you're losing fat. That also, again, your metabolic rate, that is something we'll continue. We talked about through EPOC, even after that workout. I forget what it is. I don't even know if I put it up there. I can't remember how long. I want to say it's like up to like 36 hours or something after you finish that workout. And the efficient workouts, right? And this, I actually have done HIIT workouts for a while, and I like it because personally, I don't have time to go for 2 hours to the gym a few times a week. Like, who's got time for that? I just don't. Nope, not happening. But if I can get in and out in 30 minutes, awesome. That's great from start to finish. Amazing. You get a full body workout, you get the cardio, you get the muscle, you get all of that. And it also makes it for compliance, right? So if you can get it in and out and you start to see results and stuff, you stick with it a little bit more. It's more manageable. And I like the idea of the group, right? It's also, I call them accountability buddies. Like if you're not showing up, you're gonna get a text like, hey, where were you today, girl? Like, missed you. You know, it's different if you're at home by yourself trying to motivate yourself to do it. It's nice to be in the group setting as well. And also, I'm a big advocate for making sure you're doing your movement safely. So if you're somebody who has not worked out in many, many, many years, finding a gym or HIIT workout or a personal trainer that will help you move through those movements and how to do it safely so you don't blow your back out, blow a knee out, blow a shoulder out. That's super important. So I like the efficiency piece too, where you can get that in a half hour and you're hitting most of those metrics. Cardiovascular endurance benefits, kind of already talked through all of that, anaerobic and aerobic. The hormonal, it will help to increase your growth hormone, which that also helps with hormone production. Also, again, muscle, so your insulin sensitivity. And it's variety. It's not the same thing. I don't know about you guys, but I get bored. Like if I'm like, I have to do the same type thing. You really have different type workouts a lot, so it's nice. You get a variety. And the psychological benefits. So that fast pace is nice, you're more engaged, it's less monotonous. And also it helps to boost dopamine and serotonin, which are your main neurotransmitters for mood. So that's a good one. Okay, so now what? First things you can do, strength training for optimal body composition. You want regular strength training to help preserve and build muscle mass. Your cardio exercise, you want to shoot for about 120, 150 minutes of zone 2 cardio a week. And so how you do that is just like a little calculation. You take 220, subtract your age, and multiply it by 0.7 and 0.8. And that gives you the heart rate range that you would want to shoot for your zone 2 cardio, right? So you don't have to do 120 minutes all at once. You can space this out during the week. Balanced diet, of course, rich in protein. I suggest 20 to 30 grams per meal minimum for people, 20 to 30 minimum, which sounds reasonable, but if you actually track it, you're probably really short and you're not even aware of it. Of course, there are some it's not the norm, but there are some medical conditions where you wouldn't want to have that amount of protein, but this is where you're working with a provider, right? So all that to say, in general, most people, 20 to 30 grams per meal at minimum. And then healthy fats, and your complex carbohydrates. This is a huge one, adequate sleep. Ensure 7 to 8 hours of quality sleep. This helps with recovery and hormone balance. So your sleep is when your body detoxes, it recovers, it makes all the things, it does all the things. So if we're not sleeping well, we gotta fix that. And if you have to take something to rely on to go to sleep, yeah, you may be sleeping, but we still have to dig and figure out, okay, well, why do we have to rely on something to fall asleep anyway? We really shouldn't be having to do that. So that's probably one of the biggest needle movers that I see in general for anything that I'm treating, whether hormone related or not, is sleep. Hydration, that's a big one. Most people are super dehydrated. So a minimum of half of your body weight in ounces. And reminder, if you're drinking reverse osmosis water, amazing, but you do have to remineralize that because it is essentially dead water. So remember that. You can add in electrolytes, you can do that too, especially in the summer. I usually recommend my patients have at least 1 pack of electrolytes a day. And tracking, so constant monitoring. I'm a big fan of testing, not guessing, and it's also helpful for motivation because you can see those metrics change over time. You may not see numbers change on a scale, but if we're doing an in-body scan and you can see your body composition, you're losing fat, you're building muscle, that's the goal, right? We're not looking at a number going on that. We want the body composition to be ideal. That's a big one. And then lifestyle habits. So everybody always says, well, what do I eat? What do I eat? You have to find something that you can sustainably implement into your life. Like my lifestyle may be different than somebody else's lifestyle. I'm super busy. I don't have time to sit and do, a 2-hour cooking meal all the time, right? I just don't. So you have to figure out what's going to be sustainable for you to get into there with the long-term healthy habits rather than temporary fixes. And this is across the board. Like people are using the GLP-1s a lot for weight loss. They use, we used to do phentermine back there, grapefruit diet, keto, whatever you're going to do. Fine. But at the end of the day, you still have to be making those lifestyle changes and really focusing on what that's going to look like afterwards. Because if not, you're gaining weight right back, right? So that's a really big one too, the lifestyle habits, figuring that out. Creatine, I added this one in because this is really a lot of good data with it now. So if you guys are familiar with creatine, monohydrate would be the form that you want. The body comp benefits, helps in lean muscle growth, helps with strength and power with your ATP, helps with fat loss, and hormonal support, helps with testosterone, helps with growth hormone, helps with cortisol, and also it's helping a lot with brain health too. There's a lot of data with that. Aging and cognitive support, kind of same thing with the creatine, helps with the cognitive benefits, bone health. Therapeutic dosing, usually I do a loading dose here and then a maintenance phase, and then for aging adults, like what we would do to maintain muscle mass and cognitive health. So there's different dosing there. And then best practices, timing post-workout or with meals, that helps with your absorption, and then ensure you have adequate water intake at that point too, to optimize the cell in the muscles to take it in. And I said that creatine monohydrate, that's the one that's the most researched. So that's something to do too. If you guys need more support, schedule an appointment with me. I am happy to help. You can reach me here, and I am at the Restorative Herbalism Center in Greenwood. That's the old Jonathan Bird building. So my office is in there. I do telehealth as well, and then my Scottsdale, I go down there at least once a quarter for a couple weeks and do telehealth too. Upcoming events in August, I'm going to do a pelvic floor talk here, and then in August in Scottsdale, I'm going to do another presentation there. I think I'm going to do it on estrogen and tendon, ligament, joint health as well. And then November 1st, this is a big one. This is going to be in Fishers. We do this every year. This is for our Indiana Naturopathic Association. And that's our big fundraiser for the year to help us with legislative efforts. And this year, the Women's Health Conference is going to be focused on mental health. So follow me on Instagram too, because I'm Vice President of the Association, so I'll be posting a lot more, like save the date, also how you can get tickets. If you are a business owner that would like to be a vendor or sponsor or whatever, reach out to me and I can get you all that information as well. But that's a really, it's a great conference. I think last year we had almost, a little over 200 attendees, and 2 rooms of demos and vendors and all that kind of stuff. Of course, we get cool swag bags, all kinds of samples too. Anyways, so the association website's there, and so you can check out more about the Women's Health Conference and then how to support us for licensure. That's a good one. And if you just want to learn more general about what NDs are, naturopathic.org would be the site to go check out. And then, yep, there's me. There's all my info. All right, that was kind of a lot. I do have some cards too if you guys want any of those.